When it comes to caring for the residual limb, donning, doffing, and managing the various supplies involved in upper limb loss, there are a couple of things that are very important for an occupational therapist to know. In this video, we will be discussing the wear and care of shrinkers, liners, socks, and the socket. Before we address how to care for the supplies involved in prosthesis management, let's first discuss the do's and don'ts when it comes to caring for the residual limb. Your patient should be advised to gently wash their skin with mild soap at least once a day. It's also necessary for your patient to perform routine skin checks on their residual limb. Assessing for redness or any skin irritation daily helps to prevent infection and other skin concerns from occurring. It's important that your patient knows not to shave the residual limb, as this can cause skin irritation and increase the chance of infection. Elastic shrinkers are used to help shape the residual limb and decrease the volume of soft tissue. Using shrinkers are beneficial for multiple reasons. They reduce edema, minimize the development of unnecessary soft tissue, shape the limb, prepare the limb for optimal prosthesis fit, protect the skin, and help desensitize the residual limb and get accustomed to pressure. Though it's not required, it is a good idea for your patient to sleep with their shrinker on and wear it anytime they are not wearing their prosthesis to maintain size and shape of the residual limb. Liners are used to help protect and shape the limb and can contribute as a method of suspension. It's important as an occupational therapist to help instruct a patient in the proper wear and care of their liner, as it becomes the individual's second skin and can play a large role in the comfort and fit of a prosthesis. Liners should be cleaned and cared for daily in order to maintain skin health and prevent odors and bacteria from forming. To wash a liner, turn it inside out so the gelled portion is facing outward. Use lukewarm water and scentless antibacterial soap to gently hand wash the liner. Using scented soaps can be harsh on the material and increase the rate of deterioration. Be careful not to entirely submerge the liner in water. Rather, rinse with a gentle stream. Once the liner has been thoroughly washed and rinsed, turn the liner outside in so the fabric portion is outward and the clean gel side portion is facing inward. Lay the liner out to dry or use a liner holder. Now your patient is ready to don a clean and dry liner. To don the liner, first turn it inside out. On the inside of the liner, you will see what we call the umbrella. In this example, we have a wrist articulation residual limb. Line up the umbrella portion of the liner appropriately with the residual limb, then slowly roll the liner up until it is free from gaps or wrinkles. Here is one more example of donning a liner onto your patient. This time, I will be demonstrating on a model of a transradial residual limb. Again, you start by turning the liner completely inside out. Line up the umbrella portion so that it is in the proper alignment with the shape of the residual limb. Then, slowly roll the liner on, making sure to avoid any bunching or wrinkles. Next, we will be talking about socks. Socks are used to help increase the comfort of prosthesis wear for the patient and help provide a more intimate fit. Socks for prosthesis wear usually come in 3 different levels of thickness: 1-ply, 3-ply, and 5-ply. 1-ply are typically yellow, 3-ply are green, and 5-ply are blue. Because the size and shape of the residual limb can change day to day, your patient should reevaluate the fit of their socket daily and don socks as needed. As an occupational therapist, you should be able to educate your patient on when they should either add a sock or remove a sock. Your patient should add a sock if they are experiencing any of the following: pain at the end of their residual limb when wearing their prosthesis, if their socket feels loose, or if their residual limb clicks too quickly into the socket. Oppositely, your patient should know when to remove a sock. The main reason your patient would need to remove a sock from their residual limb is if they are unable to get their residual limb all the way into the socket. In this case, your patient might need to decrease the amount of ply they have on. For example, if your patient is currently wearing a 3-ply sock, they might need to decrease the ply and start wearing 2 1-ply socks instead. In other cases, it may be best for your patient to remove the socks altogether. Finally, let's talk about the socket. The socket is the frame that joins the residual limb to the prosthesis and makes up the bulk of an individual's prosthetic device. To care for the socket, your patient should wipe down the inside and outside with alcohol or soapy water once a day. This will help maintain cleanliness of the device and extend the life of the prosthesis. Do not entirely submerge the prosthesis in water, as most devices are not waterproof. If someone has experienced upper limb loss, it's going to be challenging for them to don, doff, and care for their supplies. As an occupational therapist, your job is to help your patient problem solve and come up with ways to help them adapt. Try donning a shrinker or liner using the methods learned in this video, but only use one hand. If you don't have access to a shrinker or liner, you can also practice with a regular tube sock.